So hello, welcome everyone to Nourish's collaborative project Kickoff. We have a full and very exciting webinar for you today, hearing from the 5 teams in our cohort of 25 innovators in food and health from across the country who are looking at ways to reconnect food, culture, and health. And we will be hearing from 5 of them and then having a discussion with all of you, our partners, allies, interested folks in the field who are also working, we understand, on similar issues. So our webinar will last an hour. It will be translated simultaneously in French, and a recording will be available to participants afterwards. We will also be sending out a follow-up to everyone who is on the webinar so that you can correspond or connect with the teams and their calls to action that they're going to issue today. So I should step back and just mention that my name is Haley Lapalm. I'm the program designer and facilitator for the Nourish Leadership Program. And joining us on the call today will also be Beth Hunter, who's the Director of Sustainable Food Systems at the McConnell Foundation. And after her, you will hear from all of the teams. And then at the end, hopefully some time for discussion with you. So with that, I'm going to pass it over to Beth to give us a little bit of context for all this work.
Great. Hi, everyone. It's great to see some of you online, at least. I think we're going to go into slide share. Is that right, Haley? To tell you just a quick background of what these collaborative projects fit into in the broader picture at Nourish. So Nourish is a collaborative program that's hosted by the McConnell Foundation, but we have a number of existing partners and are developing more partnerships as we go. So there you have the early partners in the Nourish initiative. And we are, you can go to the next slide. We have a big, bold vision of building a future where the impact of food on health is understood and valued. And we do that in a few different ways. Our core strategies are really, the most developed one is the innovator cohort, and Haley will tell you about that. We are also really interested in changing the narrative of food as being essential to health, and looking at a number of different key stakeholders and how they can help to change the way that we talk about food and think about food and do food in healthcare. So that includes doctors, nurses, CEOs in hospitals, and of course food service managers and directors who are also generally our Nourish innovators. So it's partly just an invitation. Part of our work around communication is really trying to spread the stories of how food and health can be better connected in lots of different venues, media, newsletters, whatever. So it's an invitation to you if you have an interest in connecting with us in co-writing blogs, in telling stories. We'd love to hear from you. And we publish a quarterly newsletter that we want to spread in as many different venues as possible. And then the bottom circle is around the cross-sectoral convening, because we really believe in doing systemic change, that we need to be engaging with a number of different sectors: the private, the public, the community, researchers. So for example, we recently held a retreat out of which came a number of, here you have a picture of a prototyping session happening, and a number of different ideas for transformative change came up, one of which was doing a pan-provincial summit to raise the profile of food in health at the level of provincial governments. So that's also something that we're working on. And I think that the work that you're going to be hearing more about today is really at the crossroads of those 3 strategies. It's working, emerging from our innovators, and involves definitely communications and sharing, changing the narrative, and in many cases is doing that in a cross-sectoral way. So back over to you, Haley.
All right. So this work that Betha has described manifests, especially in the leadership program, as a convening question, which is how can food and healthcare enhance the patient experience organizational culture, and community well-being. So the projects that you're going to hear from today from the innovators who are across the country relates to this kind of big question that we are all coming together around. And there are 25 innovators from across the country who are part of this program. So as you can see, we are in the North Pacific, just about on Haida Gwaii and up in Whitehorse, and all the way out east to Gander, Newfoundland, and all kinds of places in between. So we have representation from 10 provinces and territories. And we see our innovators as wayfinders. So they're people who are working towards a future where healthcare organizations recognize and plan for the impact of food across the patient journey, on their communities, and in the environment. So they're a really impressive group of people, and they just went through a really impressive process where they had to collaborate on coming up with a way to spend $100,000 to have the maximum impact on the food and health systems and to create a legacy for Nourish and for their work around food and health. So this is not the most up-to-date diagram, but we had essentially in January, the cohort came together for the first time in a retreat, and then over the subsequent months spent time learning on webinars, offering webinars, reflecting and working at their own organizations about how food and health could look in the future at their organizations. And then as a cohort, they generated 14 ideas for projects that they could work on collaboratively across their institutions. After some discussion and some refining of ideas, they chose 7 that they would develop further. And then in August, they pitched 5 of the ideas. And from those pitches, they had feedback from their cohort members, from the Nourish advisors, and also from a panel of provocateurs with the idea of pushing all the teams to really refine what it was that they wanted to do with their work. And that is what you are about to hear more on today. So the team landed on distributing the $100,000 pie across the 5 of them as they saw best fit, with the idea of really landing on a suite of projects that they could stand behind, feel proud of, and that complement one another. So it really was a very exciting process. And we are going to turn it over to them now so that we can get into the meat of it. So all the teams are going to present for about 5 minutes. And then from there, what we're going to do is at the end, have a bit of a recap of the different calls to action that the teams issued during their presentations, and end with a discussion. So our first team is traditional foods. So I'm going to ask Kelly if you want to unmute yourself, and we will get started.
Great. Sego Sego Buego. Hi, everyone. My name is Kelly Gordon, and just checking to see if Leslie Carson's online as well. Leslie, are you there? Okay, well, we'll proceed forward. And if Leslie is there, then she'll jump in. We're co-chairing and co-leading the project. And yeah, we're really excited to be here today to talk to you about what our proposed project is moving forward. So if I can just see the slides up on my screen, Haley, okay, that would be great. We'll move into those now.
Great.
And just to outline who's involved in our team. Myself, I'm located in Six Nations, and I work for Six Nations Health Services. Leslie Carson is with Whitehorse General Hospital. And I'll just wait till our slide comes up to introduce the rest of our team.
Sorry, Kelly, but it's, there you go.
And Kathy Loon, Tessie Harris, Shelley Crack, Charlotte, and Dan. And our advisors from the Nourish team are Mulaney and Haley. So moving forward, how we understand the problem and who affects it. What our group is tackling is a complex and multifaceted problem or issue or challenge more so. It involves addressing political and system barriers, addressing colonial regulations that do not support Indigenous peoples in Canada. The regulations that presently make it difficult for Indigenous individuals to access their traditional food in most Canadian institutions. Another logistical challenge for facilities, specifically those involved in our project, the Yukon Hospital and the Sioux Lookout Menoyawin Health Center, they have established traditional food programs, but they receive a multitude of requests from institutions requesting information on their traditional food programs, but suggests there is a lack of how to and the technical best practices resource are not really available for others. So this could be a resource that could be available to managers and institutions who would like to initiate a traditional food program within their facilities. So Leslie, are you there for the next slide? All right, I don't think she is. I'll keep going. So why us? Why this issue? What is our relationship to the program? Our group consists of individuals who are Indigenous and/or support Indigenous populations in Canada. Collectively, we want a program that is centered around trust, friendship, and peace, looking towards mutual respect, resulting in an excellent and respectful care and service to those that we support. Individually, it can be daunting and overwhelming to address the political system and the barriers related to just traditional food programs alone. However, collectively, together, we are energized to take on this challenge, and we welcome you, all of you, to join us. Next slide. Our vision is simple. We see every Canadian institution, such as hospitals, long-term care facilities, and schools, that they would have the capacity, resources, skills, and ability to serve traditional food to not only their Indigenous patients, residents, students, and clients, but to the entire population, building and strengthening relationships through our Indigenous food and food ways. Next slide. Our projects. So we're still fine-tuning the details of the scope of our project, creating a digital guidebook and how we will position the guidebook's introduction and background section. However, in a nutshell, we propose to create a guidebook for managers and leaders who are responsible for the provision of food for Indigenous people. The guidebook will provide a relevant background information and linkages to the Truth and Reconciliation findings, and potentially including self-assessment tools. Secondly, it will have an advocacy or a toolkit to provide managers and leaders with the appropriate tools to address the political and system barriers associated with implementing a traditional food program in Canada. And lastly, this guidebook will provide technical and best practice guidelines related to sourcing, butchering, food production, service storage, and food safety for some examples. Our group does acknowledge there's a lot of work to do to lobby for change in legislation and attitudes regarding traditional food programs. However, we feel this guidebook will best prepare managers and leaders in creating traditional food programs within their facilities. So our calls to action. So moving forward, we asked the questions to those of you in the audience today. Do you think the digital guidebook would be beneficial in your present role? Do you offer traditional or country foods to your patients, residents, students? If yes, do you have standard operating procedures in your place to support traditional food program? Would you or your clients, patients, residents, students be willing to share stories related to your traditional food program? Would you be interested in getting involved? And if yes, in what capacity? And we are looking to recruit a project coordinator to help us with this initiative over the next year. Do you know anyone interested in this opportunity or someone who you could share a job posting with? And we'll leave you with that, and thank you for being a part of this today, and we look forward moving together, integrating more of our original foods and traditional foods into programs and institutions throughout the country. So Nyawa, thank you.
So thank you, Kelly, and also thank you, Leslie, as well, who I think was having trouble joining, but obviously some great work from that team. So we're going to keep moving, and the next project that we'll hear from is Food in Health is Part of Healing. So I will invite Dan and Kathy to unmute themselves, and we'll see if I can get that screen up faster.
Hello, everybody. Thanks for joining us. So I'm going to start our presentation, Food in Health is Part of Healing, enactment of the Local Food Act in Ontario, food as a quality indicator. Our team consists of Marianne, myself, Kathy, Dan, Bernice, and Travis. And our advisors include Wendy, Haley, Kathy McPherson, and Jennifer Reynolds. So the problem, how we understand the problem and who it affects. Importance of local sustainable foods in BPS institutions is not a priority. There's no accountability or reporting structure set out in the Local Food Act, no quantifiable measurements defined in the Act. Food or food quality is not an indicator or measure in provincial health quality improvement plans. Culture of good food or food quality is missing from the continuum of care, from prevention, treatment of illness, and the management of chronic conditions. Policymakers need to understand the role of food in health and its impact to the overall patient experience. Next slide, please. Why this issue? Our relationship to the problem is enhancing the patient meal experience through the use of local, sustainable foods will transform the healthcare food culture. Food is a low-cost way for us to invest in the patient experience, maximize health outcomes through positive patient meal experiences. We have learned that without the measurement of food as an indicator of quality care, we cannot create a systemic change for a culture where food is a tool for health and healing. Policy change is slow at the political level. We have to strategize at different angles. Letter to minister, meetings with MPPs, food policy critics within the other political party spectrum. And now I'm going to hand it over to my co-presenter, Dan, for the next few slides.
Essentially, with respect to vision, the question is, where do we want to be in 10 years from now? And if we've addressed the current problems at scale, we would be successful in creating a culture where food policy and food is a priority. We will have a healthier community and a more robust economy. If patient meal satisfaction becomes an indicator of quality of health, will we be required to report these indicators? And we will have created a legacy that local and sustainable food procurement can have a positive impact on health and healing. Next slide. If a baseline for local purchasing is introduced in the Local Food Act, the BPS institutions will review the procurement processes. If there's a requirement to track and measure local food purchases, broader public sector institutions will be required to get on board with local sustainable procurement. Provincial powers are creating food policy policy for food and health, but really, what are their values? We need to learn and better understand where they're coming from, and then why hasn't the connection already happened together? BPS institutions will bring additional dollars to the agricultural sector, increasing efficiencies and effectiveness on a national level. We will contribute to developing a more effective and lean supply chain. Our patients and residents will benefit through enhanced meal experiences, and we will contribute to maximizing health and healing through food. Our project team is looking to build the grassroots and create a legacy with local food procurement. And here's how we're asking for your assistance to help us. Help us build a constituency. Are you working with an institution that's already purchasing local foods? If so, share with us who you are and share with us your story. Take a pledge or take a commitment and support your local food procurement. Review your local food purchasers and determine if there's ways that you can increase the contribution to local and healthy foods within your menus. Would you be prepared to participate in petitioning and lobbying and leveraging change at the ministry level, specifically in Ontario, the Local Food Act, and on a national basis, the National Food Policy? Share your experience. We would really like to hear if you've got experience with making policy change, and can you share your experience, and would you be prepared to provide some assistance? and also for us to help us create a job description. And if you know somebody with experience with policy change, what are the type of skills that that person has, and would you or would they be able to help us? Essentially, we're seeking assistance from those willing to step forward and to help make a difference.
Wonderful. So thank you to both Dan and Kathy for that. As you can see, the teams have some big ambitions and big questions, and we're going to keep moving through and hear from the next team. And I will just invite you that you can use the chat box if you have questions for the teams, and we'll come back to them at the end, but you can start to chat them in. So our next team is Sustainable Menu Guide, and we will be hearing from Annie Marquez and again from Kathy Berger.
Yes, hi. So I'm Annie, I'm from Quebec, so excuse my English if there's some words missing. So we're creating a sustainable menu guide. It's really the future of menu creation for food manager, well, we hope. So our team is me, Cathy, José Lavoie from Quebec too, Travis from Ontario, and we have a big supporting team and a big advisory team, so we're really happy about that. So our problem that we want to solve, how might we provide steps for food manager to follow to make a sustainable food menu easy, food choice easy, and therefore design menu that will satisfy consumers, meet patient, resident needs, remain within the confines of food service production and distribution sectors, and remain consistent with budgetary norms. So it's really to have a guide that will make the choice easy for sustainable food. Kathy, my co-presenter, will continue.
Our relationship to the problem. We are passionate about making a difference for future people working in the food service industry and for future generations everywhere. Food security and local economies must be considered. The construction of a complete menu with a good variety of food with good nutritional quality within budget limits is already complex. Without easy access to knowledge about sustainable choices, managers have no time for it. People have different views of what a sustainable choice is, sometimes based on incorrect information. Information is everywhere, and yet the right information about food choices is not easy to find, especially as relevant for the healthcare system. Even distributors do not always have the information we need. Our vision for the user and ourselves. The information required to make sustainable choices should be provided according to the normal steps of a menu creation process in order to make this a doable task. Our solution should be about best practices in designing the healthcare menu. The team must test the solutions in order to become a community of practice that provides easy, applicable solutions for users. Any food service manager can become a reference in sustainable choices. Early stage solutions. Next slide. Yeah. Oh, okay, that's good. A practical, clear guide will help the menu creation process with a step-by-step approach. That meets patient and resident needs, menu format, meal content, food category, food selection steps category, sustainable criteria for each step with easy applicable solutions. It should be a simple tool, should facilitate quick decision making within a food category. Food categories are created based on similar sustainable criteria. I'm going to hand it back over to Annie so she can share her vision.
Yeah, that would be a little look at what the guide could be like. So it would be the step when you're choosing the type of protein you want to put in your menu. So you would have the type of protein listed from least to more polluting. You'll have a frequency per week that you can put those food in your week of menu. And you'll have sustainable criteria to make your choices for your menu or for recipe. So that's a bit of an example that what could be found in the guide. So what you could do to help us, do you have already a guide to create a menu for your patient that you could share? Could you share your menu? Could you provide the information on your meal content? Are you an expert in sustainable food, willing to be a consultant? Have you already created a sustainable food guide, or do you have criteria that can be shared? Can you provide certain detailed information on food you buy related to given sustainable criteria? Would you review the guide and comment, and would you use it and test the tool with the guide? So thank you.
Thank you.
Okay. So thank you, Kathy and Annie. And just a reminder that all of these calls to action that the teams are issuing will go out in a survey following the webinar today. So you'll be able to engage with them that way. And we are going to keep moving. So we're going to go over to Carlotta on measuring the patient food experience.
Great, thank you, Haley. I'm excited to be here today to talk about our project on measuring patient food experience. And I'm here representing my team, including my co-chair, Stephanie Cook, Michelle Nelson, Danielle Barrio, Suzanne House, and our advisors, Wendy Smith and Haley LaPalme. We are still welcoming additional members, so after you hear us, this pitch and presentation, if you still want to be involved, let us know. So if we can go to the problem. We really want to understand the patient experience with hospital meals. Our changes to foods offered and services improving patient experience? How do we compare with other organizations? And what can we change to improve? As a group, we've agreed that existing tools are not meeting the need. We're finding that tools are not sensitive enough to measure changes. We don't have the ability to compare with other organizations because different tools are being used among Canadian hospitals. We have high satisfaction scores many times in our facilities, yet we continue to have negative perceptions about hospital food. And we really don't have a way to capture the impact of service changes on the patient experience. Another issue that we came up as a group is that we're finding that we often don't know what patients are expecting and how their expectations are impacting the results of our surveys on patient experience and satisfaction. So why is this issue important to us? As I said, we have really found that measuring the patient experience is really complex and a challenging issue, and we are dissatisfied by existing tools. So we have many questions, and they include when we're looking at changes within our facilities as part of Nourish, we want to understand, will a shift to more local, sustainable foods improve patient experience? Will a shift to room service improve patient food experience? Will offering more culturally diverse foods improve the patient food experience? So we're hoping that having a tool to measure the patient food experience will help us answer these questions. Next slide. So our vision, where we want to be in the next 10 years into the future, is that we will have a sensitive, reliable, consistent tool to measure patient experience and have the flexibility as well to add core questions to meet our site needs. So this core set of questions we use consistently across Canada, plus ability to have flexibility to add additional questions, perhaps to evaluate a specific change. We want to have the ability, our vision will be to have the ability to compare patient food experience among Canadian hospitals, have an ability to have an understanding of patient expectations and whether we are meeting them, and as well have the evidence to support advocating for changes to improve the patient experience. So our project, next slide, will be that what we're proposing is first gathering existing tools used by the Nourish cohort sites to understand the current state. And then we plan to participate in the development of a patient food experience tool as part of the Ontario MAFRA-funded study being led by Dr. Heather Keller and Dr. Lisa Dweiser. And as well as part of that, we will review and revise the tool that they create to ensure that it meets Nourish goals. So then we may add some, for example, some questions that we feel are important for Nourish in addition to those core questions from the MAFRA study. Once the tool is developed, we hope to pilot the patient food experience tool in cohort sites, and these sites are to be determined. It will include obtaining ethics approval for the participating sites, completing a survey describing the food service model and services within the various sites, piloting the tools with the patients at the sites, and possibly comparing the results with the cohort sites to understand how we're differing in terms of satisfaction and experience. In addition, we're hoping to have a way to understand the patient experience and expectations as a result of the different work that's happening at the sites. So we're hoping to have a consistent focus group interviews that may be used by the cohort sites to capture patient expectations. So that's an additional piece that we've added to the project based on our understanding of the problem. So what is our call to action and questions? We are asking the audience today, can you provide copies of existing patient satisfaction or experience tools being used by your sites? Can you share with us your site's experience with patient satisfaction tools, and are you open to changing your existing tool? We'd like you, if possible, to review draft questions and give us their feedback. Would you be willing to pilot the tool at your sites and provide feedback on use of the tool? And would you be willing to lead a focus group to improve the understanding of patient expectations with hospital food? So we really do look forward to your ideas on how to best move forward and how you'd like to be involved. So thank you.
Great, thank you so much, Carlotta. So for our final project, we're going to go from Alberta back to Ontario and hear from Dan Munshaw, and he will be presenting on national RFP models.
Great, thanks, Haley. And on behalf of the team, I'd like to say I appreciate the opportunity to speak today and to present our project. I'll just wait for the project.
Yeah. Okay. All right, you should be able to see it now.
Yep, excellent, thank you. I want to give a big shout out to the team that have stepped forward to offer to participate in the program, to Donna, Kathy, Marianne, and Michelle, and our advisors, Wendy, Victoria, and Haley, key individuals that have helped drive this project to where we are today. But in the pitch today, we're going to have a shout out for more help as we go along here. Next slide. The challenge is the system that we currently have is fragmented and regionalized efforts to build a meaningful procurement tools, and there's a weakness on a national model. Provincial, federal, and international acts and agreements encourages price-only shopping, and there's defining and measuring and defending responsible criteria when buying and making decisions with respect to local food. So these are the challenges, and I hear from food service providers that they want to do more, but the current procurement models just don't enable them to get the right products. Next slide. Healthcare food services want to provide healthy and good tasting meals. The procurement process, however, is heavily focused on unit cost, limiting access to healthier and local foods. And in speaking with group buying organizations, or GPOs as we know them, the GPOs have stated that their process and the models that are out there lack fair, open, and transparent food procurements when establishing and evaluating multiple measurement criteria. Next slide. So the vision that we want to build, and where do we really want to be in 10 years from the future now, is we want to build an RFP model which incorporates best-in-class criteria. We want to move away from price shopping, and we want to be able to identify what are the core criteria that you want as food service professionals. We need to build that model that's compliant with, I label it as rules, but there's legislation and acts and international trade agreements, and we have to be compliant with all of those. We want to not duplicate the work and effort of others. We want to undertake research to learn what other programs are out there, and we want to do an international view as well too, to see if there's other models out there. We want to build a model, though, that seeks endorsement at the ministry level and is supported by the group purchasing organizations, the majority of spend in the broader public sector is done through group purchasing organizations. They're a critical part of the supply chain. We need their engagement. And ultimately, we want to create an RFP model that results in improved patient and resident health and to increase their satisfaction of their stay. Next slide. So what are we proposing to do, and what we think will happen is we need help from a team to pull this together. We need to engage a consultant to help all of us as individuals pull it together. We need to undertake literature and international searches on RFP models. We need to understand and document all the various rules across Canada that we're all obligated to follow. We need to seek input from the major stakeholders, producers, distributors, group purchasing organizations. For those that follow the lean principles, we need to plan, do, check, act. We need to develop the model, test the model, evaluate the model, refine the model, loop through that 1 or 2, 3 times as we learn more, fine tune and improve the process. Once we're at the point of rollout, we want to look at a national, provincial and national education and rollout. And that's our vision, this big picture. So with respect to how we're asking for help, we've tried to identify that we need assistance shorter term and longer term. We need help in hiring a consultant to help lead our team and the project. We need to undertake research to look at current models that are out there. We need to do a deeper dive into those models to find out what are their best attributes and where they've missed elements of it. We need to spend time to listen and build criteria and the challenge of how do you evaluate and measure those criteria. And then from all that extraction, we need to build a model or models. And that would be within the first 6 months. Next slide. And in the longer term, we need assistance in testing the model. We need assistance in, after we test it, to refine it. And then after we've finally fine-tuned it, we need to build a brand and marketing campaign. We need to roll out provincially, nationally into GPOs and measuring, adjusting, and reporting. So through each one of those steps, you can see that assistance is required, and we need help on that. Next step.
Great. And Dan, I think that was it, right?
Just to shout out to everybody and appreciate, because Haley can see you, if you would please raise your hand, and we're just going to do a head count of who would be interested in helping. Thank you.
Great. Good. Some of these teams are really ready to get cracking. Okay, so I really want to thank again all the teams. They've gone through a lot of work with going through the refining and integration of feedback from their cohort members and advisors, and there was a lot of thoughtfulness that went into getting us to today. So we have 20 minutes for discussion, and we're going to open it up momentarily. And at the very end, we'll hand it back to the teams again, just for a final thoughts with what they are going to take away from the discussion that we have now. So I'm going to just very rapidly through the calls to action that were shared, just so you can see those again for a second. And then we're going to open it up for discussion. And the question I want to start us off with is, what do you like about this suite of national projects, and how do you think we could strengthen them? And I really want to emphasize the idea of suite. So these are collaborative projects. They go together. They are meant to support and build on one another. So we're going to start off talking about the suite of them as a set, and then we can, from there, we'll move into kind of specifics about the projects. So maybe take a second, jot down some notes about questions that you have or thoughts that you have, and you can share some in the chat, but we will just open it up. You can use the function of raising your hand, or you can unmute yourself and jump in. So we'll just get to the last one here, and then over to you. So what do you like about this suite of projects, and how do you think we could strengthen it? And just to answer some of the questions that are coming in, yeah, we will share the projects, the slides, and then just as a reminder, there will be a survey that goes out to all of you who registered for the webinar, so that you can connect with the teams on the calls to action that they issued. Okay, so hi, Pat at Dietitians of Canada. You want to see a diagram of how they interlink. That is a great thought in terms of understanding the suite of projects. So yeah, feel free to chat, but also feel free to unmute yourself. We are hoping to get a bit of a discussion going with the teams as well. They have issued calls to action. Some of them are questions, and some of them are looking for connections around work that's already happened around this.
I'll jump in. I'm Pat Vanderkoy, and I am just blown away by how amazing and comprehensive and well thought out these projects are. I love this webinar. It's whoever thought about the consistent ways of presenting the projects and the pitches. It was very well done, and congratulations to all of you who presented. I particularly like that you are looking at so many different angles, because we know that within the food system, there have to be supporters, stakeholders from all different angles. Certainly, I'm listening to all of this, and in each of the proposals, I could see a role for dietitians being supportive in their practice. I could also see a role for Dietitians of Canada at an organizational level, certainly helping in raising awareness about these projects and about reaching out and getting some dissemination going so that more people know these projects are underway. I'm really enthused. I thought you did a wonderful job. You've got me sold.
That's great. Okay, Pat, it's great to have Dietitians of Canada support for this. I just want to flag, I want to call out Jen and Cheryl, who are also on our team, who you haven't heard from on the call today. Will you two say hi? So Jen is from Food Seeker Canada, and Cheryl, she was on the Nourish team doing communications, and along with Beth and our volunteer, Katie, they have been involved in this whole process. So I just want to make sure to name them, especially Pat, if you're handing out compliments. But okay, so
I know that they're all part of that team. So yeah, compliments to them as well.
Okay, so we had a comment from, oh, there's Cheryl. We had a comment from Linda Dalpy. When and where do you think there will be a national conference on food in healthcare? Oh, okay. I will take that as a provocation. We may not answer it unless someone else wants to jump in. Okay, other folks for comments. And you don't have to be shy, and you can chat if that's helpful. Then maybe we'll open it up too if you have thoughts on specific projects, things that you wanted to connect on or reflect on in terms of what the teams have shared.
Well, actually, I should just jump in one more time and say we host an annual conference, and if people were ready to submit something by next year in the summer, we could plan even something as big as a pre-conference workshop day or something like that. I think the conference is in June 2019 in Ottawa.
Great. Okay, Pat, that's definitely.
So there you go. That's one possible long-term vision.
Amazing. Great. And that fits into one of those circles Beth was sharing at the beginning about convening. Okay, so we have a question from Marie-Claude, and she says that the requests seem to be at a global level. So I want to understand at what level the different projects will be deployed, provincial, regional, local. I can, and maybe the teams can jump in on that, but the idea was that for the most part, these are collaborations with folks from different provinces, across provinces, and they are representing acute, long-term care, complex continuing care, Anglophone, Francophone, Indigenous communities. And I guess there is one project that has more of a focus on a policy opportunity with in Ontario, where there's a window open right now around the Local Food Act. But in general, the idea is that these projects, through at least the dissemination of the work they do, would aim to have an impact nationally. Beth or teams, do you want to respond to that as well?
No, I think that's right. There's like different levels that they'll be working at, and hopefully ways for people to get involved at the level that they work at, I think.
Okay. So great. So we had then there was a question from Melissa. I would love to see a comprehensive definition of sustainable food, since it is key to all the projects. In my opinion, it should be based on life cycle assessment. And if you need to consult with a specialist on the topic, I can put you in touch with someone. Annie, est-ce que tu veux répondre?
We made in our guide, we will have a definition of sustainable food, and we already made a lot of discussion about it in surveys and with all the definition we want to put in. So the guide will definitely have a definition of sustainable food. And for me too, it's based on life cycle assessment. So just please give us your your name and how to join you.
That's great. Annie has pushed us, the whole cohort, and has done a lot of surveying work with us already around having a definition of sustainable that includes social, economic, and environmental definitions of sustainability. So a lot of great work, Annie. Okay, so then there is a question about existing tools. And it's referencing slide 36, so I'm going to try to figure out what that is. This is from Alex, and I think the tools are probably tools Dan referenced. Oh no, actually this was for Carlotta, patient satisfaction. So I'm going to share that slide again and just turn it over to Carlotta to answer, but the question was again, what tools? As a patient at a hospital for 10 days in July, I was never asked anything about my experience. I wrote a letter on my own because I was so appalled at the food offering. So let's put this slide up so Carlotta can answer.
So each of the hospitals across Canada often put in place ways that they're capturing the patient experience or satisfaction. And that may be a tool that's delivered to a sample of patients during admission, or it could be a process after admission where overall information is gathered about the patient experience, and food is one component. And so this is why we want to make sure we have a good understanding of current state among the cohort members and how that information is being gathered. Definitely we need other ways, as you just described, in terms of as a patient putting forward your concerns is definitely important as well, and having those avenues to be able to share your issues and have that addressed is really key. But we want to have a systematic, consistent approach among hospitals to gather information from patients and understand their experience, so that we know what we need to change and how to improve, and help us to figure out, are we making a difference in the changes that we're actually making? Does that answer the question, do you think, Haley?
Yeah, that's great. Yeah, thank you, Carlotta. At least a beginning. Yes. Yeah. Okay, so we had another comment from Gord, who I believe is from, I think, Gord, you're from the Regina Food Policy Council, and you made the comment, it's important to consider and include perspective of local providers, growers, and farmers of food as they face challenge of providing and meeting requirements of institutions. Oh man, we understand this, and I'm gonna let Dan respond.
Hey, Gord, awesome question, and I appreciate the your consideration. Absolutely, when I think of national RFP model, I'm hands-on working with farmers, standing out in fields, and I'm doing forward contracts. So I really can empathize with your comment about the working with regional people. And I think how a model can be structured is that you've got to build something that's scalable, something that reaches maybe national levels for big stuff, but pulls it right down to local and regionalized engagement as well, so that you're not forgetting and you're working with with those in your region. So right on, and for sure that will be incorporated in our discussions.
Great. Thank you, Dan. Great question, Gord. So we've got another question from Carole Saint-Pierre, and I also want to invite you, if you would like to chat into the chat box, one thing that struck you about these projects, or one thought or piece of advice you might have for the team. So you can chat those in too. Okay, so we have a question from Carole Saint-Pierre in Quebec. And she says, following the message of Gord and Dan, it is important to create criteria outside of local, so beyond criteria around local, that will permit us to emphasize local products, even in the context of trade agreements. I think I got that right. So how can, I think what Carole is saying is, we can't just talk about local, because in international trade agreements, we can't give preference based on geography. However, if you know why you value something that is local, and you can detail the particular product attributes that you are looking for, such as decreasing waste or less antibiotics used in meat, or lowering your carbon footprint. If you're searching for local food, because of the particular dimensions of it that are available, then this is a way of addressing kind of that trade context that we're in. If someone would like to chime in on that, or if has a different interpretation, I would invite that. So great comment, Carole. So we have another comment from Birgit, and I think we just met you in Vancouver. So she says, in reference to sustainability, I was shocked as a hospital patient not too long ago that styrofoam dinnerware is still used. I think that while we look at food items as sustainable options, we need to look at how the food is plated also. Thank you. I suspect. Maybe Carlotta, you want to speak to that one, or Annie?
I don't really have any further comments about that one. I agree each hospital needs to continue to look at how we can improve and meet expectations, and if having, obviously China is nicer, so understanding why they're not using China, and if they can make changes over time and improve, how is that improving the patient experience is important to capture from my perspective. But Annie, do you have anything to add?
No, sorry.
No, that's great. You don't have to have the answers now. So one of the questions that I want to bring in too is, Kelly at the beginning asked about traditional food programs work, and I'm wondering if anyone on the call has experience with that, or has thoughts for that team, or worked on those issues. Or if you have not, if you had kind of any new insights or thought that you might use something like that. Okay, so you can feel free to chime in if you like, and we'll just do one other question, and then I'm going to turn it back to the teams for some closing thoughts from today. We have a comment from Pat. Pat, if you want to unmute yourself, I'll let you speak for yourself. And we also have one from C. Hughes. Is that Claire Hughes on our webinar? As she is asking what the process is to be in touch with the groups. So again, what we're going to do after this webinar is send out a survey that includes all of the team's calls to actions within it. And then you will be able to respond to the calls to action that are of interest to you. So you would be able to open the survey, say which of the 5 teams' calls to actions you want to respond to. And then there will be a series of questions where either, if Kelly, for example, asked you to contribute a story or experience, you could share your thoughts. You could just check a box if you're saying, yes, I want to be added to the pledge that you're doing, or yes, add me to your mailing list. or you could say you are interested in being one of the beta testers of the tool. So a lot of these projects are going to be looking for early adopters who are going to be willing to test their tools, whether it's the traditional food programs guide, sustainable menus guide, the RFP language. So we really are looking for folks, if you see yourselves as really wanting to help support these teams, identify yourself as folks that are willing to test and contribute to the tools that they are developing. I think I'm going to pass it just because of time. There are some other comments coming in. I want to pass it over to the teams just to share their final thoughts or kind of what they're taking from today. So why don't we start with the traditional food projects, and I believe that Shelley in Haida Gwaii is going to offer the closing thoughts for that team. I'm going to unmute you, Shelley. Okay, speak again.
Okay, so can you hear me now?
Yes, we can, and we can see your forehead. Great.
Yeah, I think that just as final thoughts, I think our project is really looking at how to get traditional foods into a variety of institutional contexts, whether it's long-term care, hospital, variety of institutions. And I think it's a combination of working with what's happening already in Canada and then also advocating for changes on policy levels to make it easier to bring traditional food into institutions. Because we just know that it's happening and that it's safe and that we can do it. So.
Great.
Support and input.
Looking for support and input. Okay, great. Thank you, Shelley. Let's go over to food and health is part of health and healing. You can tag team each other, so just go ahead and jump in. After that, we'll have Annie for Sustainable Menu Guide, then Carlotta, then Dan.
Kathy, it's exciting to see the number of people who were here to listen to what we have to pitch today. So I'm looking forward to getting a lot of engaged people helping out with our projects. Thank you.
Thanks, Kathy. Okay, Annie.
Yes, I see there's a lot of people from different from school, from correctional facilities that would be interested. So for me, the more people we can reach to, the better it is. So yeah, come and tell us how you can help us. Thank you.
So just to Pat's comment, you can see the teams are inviting you to be part of their processes and thinking as they go along the path. So by responding to their calls to action, that will be the way you can continue to do that. Carlotta.
I'd like to thank everyone for listening to our projects and coming out today. We really appreciate the support we've had so far as we've been developing our project ideas, but really need to continue to have support going forward. And as stated in my call to action, we're really interested in knowing if there's sites out there that want to test this tool that's being developed or have input in terms of the feedback on development of the tool. So let us know how and when you want to be involved with our measuring the patient food experience tool.
Great, thank you. And Dan.
I want to say thanks for everybody that's online and participated today. You're helping us feel that we're part of something much larger, and I appreciate that. I really see the strength of these partnerships and the strength of the collaboration. And I think it's through that collaborative effort that we can lobby and leverage change. Thank you.
Great, super. Beth, did you have anything you wanted to add? Okay, so in that case, we'll just thank all of you for joining and invite you to connect through the survey that is going out to the teams. And the project process really has been iterative, and these people you've heard from today are really committed to the problems that they are undertaking. And we hope you'll engage with their calls to action to help them refine what they're doing, how they're doing it, and who they're doing it with. So thank you so much, and we will speak to you soon. And thanks to everyone who presented. Great work, guys. That was good. There are some nice comments too. Someone just wrote, very good session and time well invested. So that's nice. You all spoke really well, and I'm not sure what happened with